That's right. Anywhere, anything has to do with plastic surgery, from head to toe, from pre-op to post-op. That's what it's all about. All right. But before we get started answering all the questions, I wanted to go over something that I believe is very, very important because I believe there's a lot of confusion out there. Okay. So I've been talking a lot about our newest procedure here at Pure Plastic Surgery, which is going to be the rib remodeling procedure, which we're going to be kicking off here in September. And we've gotten all these comments on Instagram, on TikTok, right? People are saying that's barbaric. People are saying the ribs are meant to be there for a reason. They're supposed to be there to protect your organs, this and that, right? And so it dawned on me that there's still a lot of confusion. People are not really understanding exactly what it is that we're doing, and they're confusing rib remodel, which is what we're talking about now, versus rib removal or rib resection. Okay? And these are two completely different things. And so I felt it would be a good idea to basically compare one to the other, put it in a chart here so that's super obvious how, the differences between the two things, okay? Because it is in no way, shape, or form the same thing. Of course, the ultimate goal is similar. The ultimate goal is to have that smaller waist, but it's being done in completely different ways, all right? So I want to make sure that people truly understand this, because all those people, you're always going to have haters and whatever, but all those, I think it's just a lack of understanding. All those people saying that, you need your ribs, you're supposed to protect your organs, etc., 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 have no idea as to what is actually going on, okay? So here we go. So, what is the difference between a rib removal surgery or a rib resection surgery and a rib remodel surgery, okay, where you are actually keeping the ribs in place? And that is primarily, number one, that is the biggest difference, okay? And that's why this is something that we're all talking about now, and it's not something that just some celebrity did, maybe that somebody heard of, and anything else, right? So, rib removal, the rib, or a part of the rib, actually leaves your body, right? You basically, you resect it. You take a rib or partial, part of a rib out of the body, okay? And it never comes back. That is rib removal, right? That is what people are so afraid of. This is not that. Rib remodel, your entire rib stays within your body. It stays inside the body. You're not removing any piece of rib. Okay? Is that clear? We're not removing ribs. Okay? Alright. So, in order to remove a rib, of course, that requires a much larger incision. In order to actually take ribs out, you have to do that through a pretty big incision. And even if you're being minimally invasive, that incision probably needs to be at least that long. 4 or 5 centimeters. Okay? When we do the rib remodel surgery, we are doing this through a pinpoint hole the size of a needle, an 18 gauge needle to be exact. Okay? Pinpoint hole. You do one little pinpoint hole over each rib that you're going to be remodeled. Okay? So large incision versus 18 gauge needle pinpoint hole. Okay? Obviously, if you're removing ribs, that's going to be more invasive, right? This is a big procedure, right? This is the type of thing that you do when you have, say, a sarcoma. You have cancer of the ribs, or either the bone of the ribs or the muscles that are near the ribs, right? That's when you do a true rib resection. It's typically a cancer surgery, right? Okay, that's definitely going to be more invasive, and the risks are going to be higher, all right? But that's not what we're not what we're talking about here. What we're talking about is minimally invasive. Again, almost virtually scarless. It's being done through a needle hole with a very special tool called the piezotome, which I presented last time. Okay? So if you guys want to look at the tool, you should look at our live from last week where we show that. You can go to our Instagram, and it's up there. You can see that. Okay? But this is minimally invasive. All right? With a rib removal, then I would agree with those comments. Yeah, you would lose a certain degree of protection for your thorax and your abdomen, for the organs that the ribs are meant to be protecting, because you're physically removing these ribs. Okay? Again, but that's because there's confusion out there. You're not understanding that with a rib remodel surgery, you're not removing ribs, and therefore the protection stays the same. Don't worry about it. Your organs are going to be protected. All the ribs are still there, guys. They're not going anywhere. Okay? All right. So, same protection. Larger surgery that's more invasive requires it to be done in an ambulatory surgery setting or most likely in a hospital setting. Again, not what we're talking about here, right? Minimally invasive, 18-gauge needle hole. We can do this in an office-based surgery setting, such as the one we have here at Pure Plastic Surgery. So, office-based and outpatient surgery. No hospital stay. You don't need to stay the night. Okay? You're able to go home, just like we do for all of our other surgeries, our tummy tucks, our liposculptures, lipo 360, BBL, breast surgeries, etc. Okay? So it's an office-based outpatient surgery. You're physically removing part of the rib, you're going to have more pain. This is a more painful surgery that typically requires sometimes doing like nerve blocks, right? When you go to resect a rib because of a cancer, like a sarcoma, those patients are in more pain, and you typically do nerve blocks to minimize that pain, okay? Again, here, we're not removing ribs, all right? So there's much less painful, especially when you're in your compression garment or your corset, which comes to the next big difference. So when you're removing ribs, you're permanently removing that section of rib, and therefore you don't need to be in any sort of compression, no long-term compression. Right, because the rib is physically gone. So, that's by definition going to make the waist smaller. All right. Here's another huge difference, right? When we do rib remodel surgery, it does require the use of compression, a corset for at least 3 months to set that rib into its new position. So what are we actually doing with the rib remodel surgery? What we're doing is a controlled fracture so that we can then reset the rib in a more inward position, okay? Which then is able to shrink the waist area, okay? So it's a controlled fracture. So think of it, say this is the rib, correct? All right? So the rib has what we call an outer cortex and an inner cortex, which is the bones that make up the rib. And what we're doing with a special device through a very tiny hole is making an incision only in the outer cortex of the rib, which then means that we can then bend the rib. So we're remodeling the position of the rib. So then the rib, it gets bent into a new position, and then you use the corset for 3 months so that it then solidifies and heals in that new position. And that way, you are then able to have the smaller waist, okay? Without having to remove a piece of rib. And that is the innovation. That is the new technology. That's why this is occurring now versus 10 years ago. We didn't have these techniques. We didn't have the special device called a piezotome, which is what we use to make that very safe but controlled fracture of the rib up until now, okay? But now we do, and that's why we're able to do this in a very safe way, but also in a way where all your structures are still there, you're not removing anything, and therefore all your organs are still protected, everything is still good, you're just repositioning that rib into a little bit of a more inward position so that that circumference, the all the way around part of it, becomes smaller, all right? And also keep in mind, we're only doing this for the quote-unquote safe ribs, the ones that we call the floating ribs, which are ribs, just so you have it there, 10, 11, and 12. Okay? We are not doing this for the ribs that are higher up. Okay? All right. Happy to answer questions about this or anything else that comes up.
First question. Pain levels for this procedure.
Exactly. So that's one of the things that we talked about here, right? So when we're talking about the rib remodel surgery, once again, you're not removing a piece of rib. You're not even doing a full fracture of the rib. You're only making an incision on the outer cortex, so it's like a partial mini fracture, and then you're setting that into place. And so when you set the rib into its new position, the patient then needs to use that corset. And so when you use the corset, the pain is minimal. Actually, the pain from whatever else we did will probably be higher. Say we did a tummy tuck or liposuction, that pain will probably be higher than the actual rib pain. But here's the key, and this is why patient compliance, that's where you come in, is so important. You must be absolutely diligent with the wearing of the corset, because the corset is what helps stabilize the rib in its new place. When the rib is stable, there's no pain. When a rib is moving around, doing this, that causes pain, right? And it can only do that if you're out of your corset. So as long as you're following instructions, you're wearing your corset, and the rib is stable, there'll be minimal pain.
Does it make your stomach smaller too?
So it basically makes the circumference of the waist, or at the level of the waist, smaller. Now, when you say stomach, I mean, it depends, right? A lot of things can be making the stomach bigger, right? Do you have a lot of excess fat? Well, then that needs to be taken care of. Do you have muscle weakness? That needs to be taken care of. Do you have muscle separation, right? So that's why you need an evaluation to determine exactly what it is that's causing your abdominal area to look bigger. And therefore, once you make the diagnosis, then you can recommend the appropriate treatment, right? So for example, if you've already had lipo 360, say you're 25 years old, never had a baby, never had massive weight loss, you've already had a lipo 360, and you want your waist to be a little bit smaller, well, in that particular case, then the rib remodel is probably a good option, okay, to make the waist smaller. However, say now you've had 2 kids, you've never had any other surgery, you have a lot of loose skin, you have muscle separation and weakness, which makes your belly look like it's 3 or 4 months pregnant all the time. Well, this is not the surgery for you, right? What you need is a tummy tuck. You need a tummy tuck to remove all the excess skin and to do the muscle repair, or technically called the muscle plication.
So you said that you have to wear the corset for 3 months. Is that pretty much the recovery time?
Exactly. Yeah, that is the recovery time, and it's very, very strict, okay? This is why I want everyone to understand, like, this is not elective. Like, sometimes I know we do liposuction, I tell you gotta wear that faja, and some people are like, well, it's hot and I just don't want to wear it anymore. Okay, it's not like that, right? This is a full-on 3-month commitment, okay? Because if you don't wear that corset, then things may not heal in the position that we want them to heal. You may then not go through all this and not get the result that you wanted. The rib might move and cause pain, right? And so all these, potentially negative things can happen if you're not compliant with wearing the corset for at least 3 months.
All right, another corset question.
Yeah.
So do you wear this corset all hours of the day, even when you sleep?
That's right, exactly right. So you pretty much take it off just to shower, because guys, we still want you to shower and stay clean. But you take it off essentially just to shower, and then other than that, you're wearing it night and day.
All right, so what procedures can I combine this with?
So that's a good question, right? Well, if you're doing another, I didn't put it here as kind of a differentiator, but it's a great question, because when you're doing this, like I said, huge surgery, you're probably just doing that on its own. You wouldn't combine that. But again, that's not what we're doing. We're doing just the remodeling part of it. And so with that, you can actually combine it with other procedures, such as your breast procedure, liposuction or liposculpture procedure, fat transfer or BBL procedure, and even a tummy tuck procedure.
Do you have patients who get this surgery by itself?
Yeah, certainly. So it's definitely something that can be done on its own. And that's typically the patient who, say, has had 1 or 2 rounds of, say, liposculpture BBL, right? So they've already gone through that. They've removed as much of that superficial or subcutaneous fat as possible. But they still, they still want to, reduce that waist just a little bit more. And so you can do the procedure on its own. That's one patient. Another patient is the fairly thin patient. The patient doesn't have a lot of fat, and therefore doing liposculpture maybe wouldn't make such a big difference. But if you combine that liposculpture with the rib remodel, then you'll have more of that curvy figure, or you can do the rib remodel just on its own.
Can you work out, or do you need to stop completely for 3 months?
So you're not going to be working out for at least 8 weeks or 2 months. Okay, so you're not going to the gym, you're not being very reactive or anything like that.
Is there a possibility for the ribs to reset back to original shape?
There is if you're not compliant. Okay, so if you don't tolerate wearing the corset, you decide you don't want to wear the corset, you don't appropriately continue to kind of cinch down the corset as time moves along, then yeah, it is possible that that it comes back to its original location, and therefore you don't lose all the all the inches in the waist that you're gonna lose.
All right, so this is a little off-topic question.
Yeah.
Hi, doctor. I recently had a BBL with you. I love my results. Just wondering when I can hit the gym and pick up my child.
Awesome. Well, thanks for the shout out. Yeah, when can you hit the gym? At 6 weeks. And then your child, if they're over 15 pounds, is going to be 6 weeks as well. Now remember, with the child though, if somebody else picks up the child and kind of puts him or her in your arms, then that's totally okay. All right, so just keep that in mind. But then yeah, certainly going to the gym, working out, strenuous activity, heavy lifting, we want to wait at least 6 weeks.
Thank you. Now for rib remodel question. During the process of healing, can you breathe completely fine, or are you going to have pain breathing?
You're not going to have pain breathing. You're going to breathe the same way that you would breathe right now if you put a corset on. Okay? So if you want, try it. Get yourself a corset, cinch yourself down, and see how see how that feels. And that's how it's going to feel.
Another question. Okay, tummy tuck.
Okay.
With my tummy tuck, can I combine liposuction and chin lipo?
So with the tummy tuck, you can combine a certain amount of liposuction, which is here in the state of Florida, and all states have different rules, and different countries have different rules. Okay, but here in Florida, when you do a tummy tuck, you're limited to removing 1,000 cc's of fat via liposuction. That's the max when you do a tummy tuck. So typically we combine that with liposuction all along the flanks and the waist, all along the sides here. And yes, typically, and yet if you want to add the chin, that's okay, because the chin actually has, is typically very minimal fat. So it doesn't really add to that 1 liter or 1,000 cc's of fat you can remove. So certainly adding the chin for lipo or face type plus lipo is totally okay with your tummy tuck.
For the rib remodel, where are the scars located?
So like I said, so first of all, the scars are going to be tiny, right? Like an 18 gauge needle hole. So, okay, and they're going to go right over each individual rib at the area where you're going to create that controlled fracture. Okay, so let's see, I don't have a lot of room back here, but let's see here. So say you're going to go for rib, like I said, 10, 11, and 12. It's going to be little tiny hole over each rib. Okay, it is approximately 8 centimeters from the midline of the back, so this is the center of the back. It's about 8 centimeters from the midline of the back, and you put the little tiny hole over each individual rib. Okay, but like I said, once everything is healed, it's basically virtually scarless. You're not going to see much of anything at all.
Follow-up question to that was, if you're getting the rib remodel with a tummy tuck,
yeah,
are you still having the same scars?
So yeah, well, the rib remodel scars are similar to what I just discussed. The tummy tuck scar is going to be the same as the tummy tuck scar. There are some special considerations, okay? Remember how I was saying how important it was to wear the corset? When you do it with a tummy tuck, you're actually going to delay the corset part of it a little bit. So you're not going to be wearing the corset till anywhere between 5 to 7 days after surgery, because we want to make sure that the skin is doing okay, that everything's starting to heal from the tummy tuck aspect of it before we put you into that corset. So you are going to be wearing, of course, your abdominal binder still. So your foams and your abdominal binder the same way as you would with a tummy tuck, and we can cinch that binder now down and keep it nice and snug. But we're not putting you in a full-on corset until 5 to 7 days after.
Do you know how many inches it takes off your waist?
So I've heard anywhere from 2 to 4 inches. 4 inches, guys. That's a lot.
And this is permanent?
And it's permanent. It's not going to bounce back. I mean, once the new ribs heal in their new position, that's it. Then there's no way for them to go back to their original position once they're healed, okay? Right? We asked that question, like, what happens if you don't wear your corset? Then yes. But once, say you wear your corset 3 months, it's solidified in its new position, that's where it stays. It's not going to bounce back.
Is it okay to wear the corset for more than 3 months?
Sure. I mean, most people are completely sick of it by then. But yeah, that is definitely okay.
Are we shown at your office how to wear the corset or how tight to wear the corset?
Yeah, this is something that we need to go with each and every patient, because it's not like let me say this, it's a gradual tightening of the corset, right? So initially you're going to start with the corset obviously snug, but not like super tight, and then as the days progress, you keep cinching it down about a centimeter a day until you get to that full position of the corset. So it is something to it's a little difficult to just explain by talking about it. So yes, it's something that we would have to like guide the patients, kind of walk them through it, take them by the hand, exactly how they're going to wear the corset, how much they're going to cinch it down, and when they're going to stop cinching it down and just keep it stable.
I know you went over this, but we have a few questions on TikTok and Instagram about how invasive is it and what is the recovery time?
How invasive is it? That's what I just talked about.
Yeah, sorry.
All right, so that was the whole point of the conversation here, right? So that's the huge difference between, and what I truly want people to understand, that it's not the same as removing or resecting a rib. This is very different. This is where just repositioning the rib. So the rib never leaves the body. That's why it's called the rib remodel surgery, okay? And it's what I would call minimally invasive in that sense, right? It's being done through a tiny needle hole, 18-gauge needle hole, with a special tool called the piezotome, where you're doing a controlled fracture of only the outer part or outer cortex of the rib, so that you're able to then bend the rib. It's what's called a green stick fracture, if you guys want to look that up. Green stick fracture. So you're creating a green stick fracture of the rib in a controlled fashion and then allowing it to heal in a new position.
I'm having surgery August 20th. Are you going to be doing this procedure anytime soon?
So unfortunately not in August. We're looking to be starting the procedure September 1st.
Can you do a rib remodel and tightening of the abs at the same time?
Yeah, so that would be kind of like combining like a tummy tuck with this procedure, right? So when you do your tummy tuck, you are doing that muscle plication or repair. And so you can combine the tummy tuck, including the muscle repair or plication, with the rib remodel procedure.
Doctor, after liposuction, how can we prevent bacterial or an infection?
Good question, right? So first of all, let me just caveat that with saying you can never prevent things 100%, right? In medicine, nothing's ever 100% or 0%. But what you want to do is you want to try to minimize that risk as much as possible. And it's something that we do here at Pure Plastic Surgery, and that's why our BBL, infection rates are very, very low at about 1.5%. So what do we do to get it that low? Well, we do a lot of things. Number one, we give you IV antibiotics as just before the start of the surgery. We also give you oral antibiotics to take for a week after surgery. We then, of course, we do our normal, sterile prep and draping for the procedure. But before we do the fat transfer, we do an additional prepping of the patient with betadine. Every time that we use the cannula to place the fat, we wipe that down with betadine as well. And then on top of that, we do put also antibiotics with the fat before we do the fat transfer, okay? Other additional steps that we do, because we are Joint Commission or JCO certified, the highest level of certification an OR can have, is that we use UV lights prior to starting any procedure to additionally sterilize the room from anything that's even in the atmosphere, right? Because UV lights will kill not only stuff on the surface, but stuff in the air as well. So it kills all sorts, pretty much all viruses and bacteria prior to starting the procedure, okay? So we go through multiple, procedures at the clinic level, at the staff level, at the patient level to try to minimize that risk of infection, to try to get it very, very low, about 1.5%.
Do you perform glute implants, and what is your opinion about that surgery?
So I personally, I don't perform glute implants, so I'm very, very well known for fat transfer. Okay, so if you want to enhance the gluteal area, I do fat transfer or BBL. And I personally, don't have the experience and don't do a lot of actual, gluteal silicone implants. Okay, for most patients, I don't believe it's actually necessary, but there are some patients where, yeah, maybe they're very thin, they don't have a lot of fat, and they could benefit from the gluteal implant. You have to be very careful with the gluteal implant, and that's also gone through a kind of an evolution, if you will. I think back in the day, people were using gluteal implants that were too big, and these were causing a lot of problems. They were flipping, they were causing wounds to open, they were causing infections, and a lot of them ended up being removed, okay? Today, those surgeons that use or do gluteal implants, they're typically using a smaller gluteal implant. They're putting it a little bit deeper. They're putting it in what's called an intramuscular plane, so kind of like within the muscle, okay? So it provides a little extra protection for the implant. And then they're doing some minimal fat grafting around the implant to kind of soften the look of it. And if you do it that way, I think that's the correct way of doing it, and you have better long-term results. But you got to find someone who's a real expert at doing this.
What if you already had a tummy tuck? Can this rib remodel be done?
Yeah, sure. Definitely. So again, we talked about it last week again, and in terms of like who is a candidate for this procedure, and I'll just mention a real brief right now, but if you want more details about that, please look at our live from last week on our Instagram, okay? But this is meant for a patient that's going to be that's going to be lower on the BMI scale, okay? I'm talking BMI 25 or below, okay? Someone where I can actually feel and palpate the ribs, right? It is very important that I'm actually able to feel those ribs. So if there's a ton of fat in the back where I can't see or even touch the ribs, you're not a candidate for this procedure, okay? The other thing that it requires people to have good, strong bones that are able to heal well, okay? So it's typically for patients that are 45 years old or less, okay? And also that don't have any, medical conditions that affect their bone, like osteoporosis or things like that. So you need good, strong bones. You need to be relatively thin in the back so that I'm able to, palpate each individual rib.
Do you perform any filler treatments to fill BBL gaps?
Filler treatment? Yeah, I think that's a great question because today, we have pretty much the best filler there is out there, which is what we call alloy. And if you guys haven't heard me talk about alloy, you can go to our YouTube channel or go through our IG. But alloy is a great product. It is off-the-shelf fat. So it's basically fat that I'm grabbing off the shelf, cadaveric fat where all the DNA material has been removed. So there's no reaction and the fat cells are intact, and we'll use that as filler, which we can use to fill certain areas if you have small areas that need additional filling after your BBL. It's a great way to do it because it can be done in the clinic setting under local anesthesia without the need for any general anesthesia or prepping, for general anesthesia surgery or anything like that. And it's done with very little downtime. Basically, you're back to your normal life almost right away.
Is it normal that 7 days post-op for your BBL to look flat?
It can be. Every patient is different, but when you go to do the BBL, right, especially as you're trying to create projection, a lot of it depends on the patient's skin. And if you have skin that, basically relaxes easily, there's a lot of what we call elasticity. It's able to stretch out. Then that patient is able to take more fat and they end up looking rounder right off the table. Now, if you have a patient that has tight skin, so the skin does not have a lot of elasticity or ability to stretch out. Well, that patient, you can put in as much fat as you can, but eventually that skin's going to get very, very tight, and it won't expand anymore. And so for that type of patient, initially, you may see the buttock look flat. But what tends to happen is that over the course of the first 3 months, as that skin begins to stretch out, okay, then it starts to round out and you get a more rounded projection of the buttock as time moves on. And typically by 3 months, it becomes a lot better.
Thank you. We're all set with the questions.
All right, awesome. Excellent. All right, guys. Well, I hope this clears up a lot of the confusion that happened over the last week. I hope those people that were saying that this is absolutely nuts or crazy and that you need the ribs to protect your organs, I hope you understand now what it is exactly we're talking about. Okay? But yeah, if you have more questions about this, just drop us a DM. I'm happy to answer. And I will see all of you next week on Hump Day with Dr. Alex Earle. Take care, everybody. Ciao.